Good afternoon, everyone. So today's topic is sports nutrition to excel performance. And it's been conducted by Dr. Hashan Amarathunga, sports and clinical nutrition physician of National Hospital, Sri Lanka. Dr. Hashan obtained his MBBS in University of 𝗙𝗕𝗦𝗓 in 2012 and got his MD in clinical nutrition in Postgraduate Institute of Medicine, University of Colombo in 2023. He's an accomplished sports nutrition physician with a clinical nutrition background and one of the pioneers to develop sports nutrition delivery in Sri Lanka, and specializing in evidence-based strategies to optimize athletic performance across multiple sports. Author of the nation's only book on sports hydration with a focus on knowledge dissemination in new sports-specific product development and innovative approaches to advance in sports nutrition. So, without further ado, let me welcome Dr. Hashan Amarathunga to commence the lecture. Thank you, sir.
Right, thank you very much, Dr. Anish. Good afternoon, everyone. First of all, I must thank GMOA Academic Subcommittee to inviting me to discuss a mostly unknown area for majority of doctors. But I am pretty sure that you had to answer these kind of questions in your day-to-day life, in your medical career. Most times, these kind of questions come from your relatives, parents, and your friends rather than your patients. For example, I get these kind of questions very frequently. For example, mostly from doctors. For example, let's say my son is starting doing this sport, and coach is planning to start this supplement, and is it really necessary? Those kind of questions are very common, and most people are not now going to gyms, and they need to learn almost everything about sport nutrition. Their diet, their supplementation, and hydration is very commonly asked from them. But the problem is most times we haven't had a chance to learn about nutrition in our medical career. Nutrition is not taught in the medical faculties, and even after passing out, we haven't had a proper opportunity to learn about nutrition in most cases. But so there's a gap. So sport nutrition is a very vast area. Sport nutrition is a subspecialty of clinical nutrition. So it's a very tiny area of this vast nutrition field. Specialists in this area, sport nutrition is very minimal, even in Sri Lanka and even in other countries. So my sport nutrition career started when I did the after doing the IOC Diploma in sport nutrition. I did it in 2021. I am the second Sri Lankan to did it. And first one is in Australia, looking after the under-19 national cricket team. So after finishing it, I worked with multiple sports. With time, I was able to join Sri Lanka cricket. So when I joined Sri Lanka cricket, no one had idea how to manage sport nutrition and how to get the benefits of sport nutrition. So when I joined Sri Lanka cricket, their diet looked like on the left side of the picture. But with time, we were able to improve the dietary recommendations and delivery to a certain acceptable level. So we developed a lot of guidelines to deliver nutrition, hydration, supplements, and we have conducted over 100 sessions for different levels of athletes during the last 2 years, and we have got down the high-tech stuff that need to manage nutrition, and we were able to get down the most highest certified supplements. And but all of all, we were mainly targeting to educate the athletes, because when we give the knowledge, they start to practice. So there's a gap in knowledge basically. So and every time we had a chance to sneak a peek to the other teams, we try to get down the knowledge from them, and we were able to contact most of the nutritionists who work with national level cricketers. So we were able to improve our knowledge significantly with that. So I had a good time with the team for the last 2 years, and a good and exciting time. But whatever we do, how many times we arrange the guides and everything, there are certain times that the expected quality is not there. So we need to continuously monitor and improve whatever the available practices. So coming back to the sport nutrition, so whatever we do in athletes, we are trying to improve the performance. So performance is dependent mainly two things, that is genetical input and training.
Right.
So there are multiple other factors that help to improve performance. Nutrition is only one of those factors. So if you follow sport nutrition properly, it will help to improve performance of athletes, and it will reduce the chance of getting an injury, and athletes will have reduced recovery time, and they will be able to stay healthy. Mind you, majority of athletes are not healthy. They have some form of health related problem. But nutrition is very basic stuff, very basic thing. When you don't do the basic stuff correctly, the problem comes when you are going to do high level, advanced, high intensity things. So in the initial phase, when you met with the athletes, the first thing we are trying to do is to develop a day plan for them. But day plan means, let's say they have a practice session or competition tomorrow. Yeah. So it starts at 10 a.m. So for example, then we are trying to develop what to eat for breakfast, what is the composition, how much to eat, something like that, and what to take before practice, during practice, after practice, for the lunch and for the dinner. Those kind of things are the initial things that we plan. That is called day plan. So we usually develop day plans for practice day, competition day, and rest days. But the high-end sport nutrition plan is a really complex thing. It takes at least 3-4 months to develop a plan for a player. So as a sport nutrition specialist, we manage 4 things. That is diet, hydration, supplements, and body composition. Those are the main 4 things that we look after. So to manage those things, we alter these 4 things. That is macronutrients, micronutrients, liquids, and supplements. Those are the 4 things that we manage. So when it comes to discuss about sport nutrition, first thing we discuss is pre-event fueling. How to do diet before start of the practice or competition. So when we come to discuss about the main meals, ideally you should take at least 3 hours before the start of the practice, because when you take meals so close to physical activity, it will negatively affect your performance. And ideally you should take rapidly absorbing foods like high glycemic index carbohydrate along with lean protein, and it should contain minimal fat and fiber. This is almost completely opposite that is told to the general population. And the main problem in Sri Lankan context, not just for the athletes, for the general population, they don't know how much to eat. That is the main problem. So for example, this is the amount of rice that contained in 1 cup of rice. For 99% of the population, you don't need to eat more than 2 cups of rice. For athletes, 95% of the athletes, you don't need to recommend more than 2 cups of rice for one meal. What we are trying to improve is frequency of eating. So ideally, if you are an athlete, you should target to eat at least 8 meals a day. So there are some athletes who eat 12-13 meals per day. So what we are trying to do is increase the frequency of eating, not the amount you eat for one meal. So reducing rice amount is relatively easy, but when you come to other foods like other carbohydrate based food, it is relatively difficult to reduce the quantity, because this size, one bread slice contain equal amount of carbohydrate in 1 rice cup. So you can't eat more than two slices of bread at one time. If you are taking from the sandwich bread slices, 2 sandwich bread slices equal to 1 cup of rice. So you can't eat more than 4 slices at one time. When it comes to string hoppers, 4 string hoppers equal to 1 cup of rice. So ideally you can't eat more than 8. But our guys eating over 15-20. That means you are eating 5 cups of rice at one time. So it is way higher than the required amount actually. So when it comes to roti, half of this size roti is equal to 1 cup of rice. So you can't eat a lot. And most of the athletes like to eat oats, and half cup of oats is equal to 1 cup of rice. So you can't eat, even though it is healthy than other foods, you can't eat a lot of at one time. So after taking the breakfast or the main meal before the practice, you can have a small snack, pre-game snack. that also should come from a carbohydrate based food. Why we are suggesting to eat more carbohydrate is the main energy source of muscle is carbohydrate. Carbohydrate is stored in muscle as glycogen. So when the glycogen store is high, you can stay without getting fatigue for a longer time. If the glycogen store is low, you will get fatigue very quickly. And the other thing is when the intensity of the activity goes up, the carbohydrate is the main energy source of the body. For example, if your intensity is very high, only energy source in the body is highest, almost 100% of the energy is developed from the carbohydrates. So if you eat correct amount of carbohydrates at correct times, you can stay without getting fatigue for a long time, and also you will be able to do high intensity activities better. So the third thing is during practice, during game, during competition is fueling. So if the event lasts more than 1 hour, you need to take carbohydrate based snack to refuel the body again. So there are a lot of options. You can go with a fruit or sandwich with the jam sandwich, or most easiest thing is to utilize is date, because you can it is easily carried, it can be carried, and you can keep it in your pocket without much trouble. And there are high advanced stuffs like energy gels and sport drinks. For example, this is a triathlete athlete who had taken 104 grams of carbohydrate every hour during the bicycle ride. So 104 grams is almost 4 cups of rice. He had taken 4 cups of rice every hour. So you can't go with solids alone. So at that time, gels and sport drinks are vital. So he had taken only 15% from solids. So energy gel means it's a rapid absorbing carbohydrate, mainly containing maltodextrin. It absorbs within 5 to 10 minutes. But if you take a banana, it takes at least 20 to 30 minutes to absorb a banana. But this energy gels absorb within 5 to 10 minutes. So it's a quick you can get quick energy by taking this kind of product. So when you take carbohydrate based snack during game, there are a lot of research to prove that it will improve the performance. This research from football based one. So when they take carbohydrate in between the sessions, the agility, dribbling and kicking accuracy was improved about 2 to 3%. Mind you, even 1% improvement of performance at the highest level is a significant number. Even 2-3% means a very high number. So then we can discuss about the post-practice, post-event fueling. We call that recovery meal. So this is the time you need to have some protein in your snack. So ideally you need to take about 0.3 grams per kilogram, because this is the time muscle get recovery, and bulking is happen mostly at this time. So you should take it as soon as possible after finishing your physical activity. So best option would be a carbohydrate protein based one, like chicken wrap, egg sandwich, like a thing. But you can take your main meal even right after practice, that's also okay. And you can take chickpea, cowpea, like a thing. And even if you don't have anything to it is ideal, at least you have to take something like a milk packet. So you should take something rather than not taking anything. It is best to take something. So when it comes to proteins, the general requirement is about for the general population is about 0.8 to 1 gram per kilogram per day. But for athletes, it is relatively high. It is about 1.2 to 1.7 grams per kilogram per day. But going beyond 1.7 is most times doesn't necessary for athletes. But for bodybuilders, we can go beyond that. For teenagers, with consideration of growth, we need to give little more protein than the other adult athletes. So let's say, so if you know the weight of the athletes or your weight, it is much easy to calculate the protein requirement. Let's say we have a athlete with a weight of 50 kilograms. So his or her protein requirement would be around 100 grams per day. So there's no point taking all the protein requirement within one or two meals. Ideally, you need to take in separate times, at least 4-5 times a day. So if you're taking 100 grams, you need to take, let's say you are taking it in 4 times a day. So one meal should contain around 25 grams of protein per time. The best times to take protein is you can take it with 3 main meals, and after practice is another good time. And the 5th best time is pre-sleep, before going to sleep. So you can easily calculate the protein requirement. Then if you know the content of protein, how much protein is contained in every food, then piece contain about 7 grams of protein. So if you are taking 25 grams of protein, that means you need to take around 100 grams of fish or meat piece. One egg contain about 7 grams of protein. Lentils, 3 tablespoons of lentils contain about 7 grams of protein. Dry fish and sprat, 1 tablespoon contains 7 grams. 200 ml milk, fresh milk contain about 8 grams. So you can easily identify whether the requirement is covered by knowing these facts. So when it comes to animal proteins, there are 2 types, lean meat and red meat. The main difference between lean meat and red meat is red meat contains relatively high amount of fat. So when you have high amount of fat in the food, it increases the absorption time. So for example, pork takes about 4-5 hours to absorb. Beef takes about 3-4 hours to absorb. So these kind of food not ideal to take before practice or during practice, because it will retain in your gut and it will negatively affect the performance. So ideally you need to take a food that rapidly absorb. So most, especially young athletes prefer to eat processed meats, but you should discourage that, because athletes need to take relatively high amount of protein for a longer time. So there's a high chance of negative effects of them developing on them. So there's a high chance of developing cancer and other complications. So processed meat should be discouraged. And when you take a large amount of protein, the excess protein is passed from urine, so there's a chance of developing gout also. So taking high amount of protein is not ideal. There were a few incidents in cricketers also in the last 2 years. So we have to take the correct amount. Taking low and high both are negatively can affect. So third macronutrient is fat. So fat doesn't give a positive performance benefit. So we are trying to reduce the fat intake actually. So if you are taking fat, you should take healthy fat, which contain mono polyunsaturated fatty acids, but you should try to reduce the unhealthy fats, mainly deep fried products. For example, let's see this, the boiled potato contain 100 grams of boiled potato contain around 76 calories, but if you deep fry it in a chip, it goes up to 450 calories, very large amount, same 100 grams. So there's a significant difference of calorie content when you deep fry a food. So you should avoid these kind of foods. So going to the micronutrients, so most of the athletes are able to cover their carb and protein requirement most times, but more frequently they are not taking adequate amount of vegetables and fruits, and their micronutrient requirement doesn't cover most times. So we should encourage them to increase their vegetable and fruit intake to cover the micronutrient requirement also, because they need more than the recommended amount for a general population. Because micronutrient is required for every action in the body. So when they doesn't take the adequate amount of micronutrients, it will negatively affect the performance. So we usually say eat a different color food, because different color fruits and vegetables contain different micronutrients. So for example, if you are cooking 2 vegetables for a meal, ideally you should use 2 colored vegetables. So the main, as I said earlier, the main problem in our context is most people don't, even athletes and even general population doesn't know how much to eat. So when it comes to athletes, on a practice day or a match day, their plate should look like this. So at least half of your plate should contain carbohydrate. So it should not, if you are eating rice, it is not more than 2 cups. And you can easily calculate the protein requirement when you get the idea from how much protein. If you know the weight of the athlete, you can easily calculate the protein requirement for one meal. And you should reduce the vegetable intake on a match day, or especially on a match day, because vegetable contain little bit high amount of fiber and it reduces the absorption. So better to reduce vegetables especially on a match day. And there should be a difference on match day meal and a rest day meal. The main difference is the rest day meal contain relatively low amount of carbohydrate compared to match day, because we don't utilize the carbohydrate during a rest day, so you need to reduce the carbohydrate intake on a rest day. And the protein is the same amount, you can take the same amount in the rest day also, and you can increase the vegetable and fruit intake on rest days compared to our match day. So those are the basic concepts about diet. And the second important part is hydration. So hydration is the easiest one to correct and most cheapest one to correct actually, and easiest one to get a significant benefit. Because if you lose 1% of your body weight by sweating, it will negatively affect the performance. If you lose more than 2% of your body weight due to sweating, it will significantly negatively affect performance. So this is a data from a practice session that we collected the weight differences in the national cricket team. So in here there are 6 people who had lost more than 2%. So it is very common thing, not that uncommon. So if you ask from these red guys whether there's difference in if there are different feeling for you, but most times they won't tell anything, because even losing 2% of your body weight, they will not feel even thirsty. But it will significantly affect the performance. This research was done in Sri Lanka using national fast bowlers. They have divided fast bowlers to 2 groups. For first group, they have given the correct amount of fluid, and other group they have restrict the fluid intake. So they have assessed the pre and post practice performance parameters of fast bowlers. And so in the first graph shows the bowling speed, fast bowling speed. This FP means the correctly hydrated people, players, and the FR is restricted fluid intake athletes. So in the restricted fluid intake athletes, there was a significant reduction of speed, bowling speed, but number wise it was not that significant. And the second graph shows accuracy of bowling. Both teams have reduced the accuracy, but fluid restricted team has significantly reduced the accuracy. So usually it affects the dehydration affect the accuracy of the performance. So if you don't check this, you can't even find this kind of thing. So first thing we have to know about hydration, how to assess whether you are hydrated or not. So easiest way to assess is by checking the urine color. So if the urine color is darker, that means you are not adequately hydrated. But when the urine color get dark, means that you are already dehydrated. It is a late parameter to assess. So we need to have a better one. In our setup, the best, easiest and easiest way to assess hydration is by measuring weight. We can assess weight pre-practice and post-practice. Ideally, there should not be a weight difference. If there is a weight reduction or gain, that means your hydration management is not ideal at that time, at that practice session. So there are high-end things like sweat patches and chemical sensors to assess sweat rate and chemical composition of sweat. We have tried few of these, but there were some complications during the assessment, so they were not ideal in our setup at the moment. So because these ones are not, we have tried this, but not we were not able to implement it at the till now because due to some technical problems. So on average, if you practice 1 hour in our environment setting, usual average sweat rate is about 1 liter per hour. That is the average sweat rate, 1 liter. Some athletes lose over 2 liters per hour. So the first thing we need to identify is those athletes who are losing too much sweat, because they are the ones who has the highest risk to develop a muscle injury or cramp. And sweat contain various kind of electrolytes. The most highest concentrated one is sodium, and there are athletes who lose more sodium than other ones. So if you lose more sodium, you will get this kind of a line along with the sweat line. So the second step of hydration management is identify these kind of players who lose more sodium than the other athletes, because those are the ones can have higher risk of injuries and muscle cramps. So once you know the sweat rate and chemical composition of sweat, then we can go to manage the hydration. So in most settings, our athletes use only water. That is not ideal way of managing hydration. You have to have an electrolyte containing product to manage. The usual thing that we say is take at least 50% of fluid requirement from electrolyte containing fluid. So there are various options. The easiest one we can get is GMOA, and there are high-end electrolyte tablet and salt tablets also. But you can use anything in the initial phase, but ideally you need to have an electrolyte containing product. Otherwise, you will have a higher risk of getting injuries, and your performance will be reduced in the long run. So ideal product should be an individualized one. So ideally we need to develop a fluid that individually prepared. So in the highest level, like in football, in Europe region, or every player knows their sweat rate, their composition of sweat, and they will get an individualized fluid to every match. So ideally it should be like that. Individualized electrolyte containing cooled and flavored drink is the ideal sport rehydration solution. And overhydration is overhydration gives more complications than dehydration, so it can even kill you. So there are enough cases of death due to overhydration mainly during marathon and cycling races. So overhydration is much worse than dehydration, so you should always try to avoid overhydration. So third part is supplements. So supplements has a benefit, but that benefit is very small. To get that benefit, you have to follow the basics first actually. So without following the basics, the benefits of supplement will not be there. So you can't replace basics from supplements. So first you have to follow the basics: diet, hydration, body composition. You have to optimize them and go to get additional benefits, you can go for supplements. So there are various kind of supplements. Over 100 products are there, different kind of supplements. Out of all the supplements, the most beneficial one for majority of athletes is most beneficial supplements for majority of athletes is caffeine, which is easily accessible one. But you have to know when to take it. It is a stimulant actually, so it increases vigilance, alertness, and reduce the feeling of the tiredness. So if you take caffeine every day, it will reduce the effect of that. So ideally you should not take every day, and you should keep it till only for match days. Ideally you need to take it 60 minutes before the start of the match. So let's say in cricket, I usually say 1 hour before the start of bowling, 1 hour before you start off batting. So creatine is another good supplement that athletes use. It is especially on people who need rapid actions like throwing events and in team sports. Creatine has a good benefit. So ideally you need to load it before going for a maintenance dose. It is a very safe supplement when you take it in the correct way. And another supplement that more commonly used is nitrate. So most times athletes use beetroot as nitrate supplement because the beetroot contain high amount of nitrate. Like GTN, it increased the blood flow to muscle. It dilates the blood vessels. So most popular supplement in our context is protein, but if you can cover the protein amount, protein requirement from your diet, you don't need to take a protein supplement. Majority of time, athletes can cover the protein requirement from diet alone. In rare instances, there are people who need very high large doses of protein. You have to use protein supplements, but most times we can cover the protein requirement from diet alone. So there are different kind of protein. Protein mainly categorized to whey protein and casein protein. The whey protein absorbs much faster, so it is more popular among athletes. Casein protein takes little more time, about 3-4 hours. So ideally it should take pre-sleep. So in the market there are different kind of protein supplements. So mainly there are 3 types. So there are concentrated protein supplements. So protein content is relatively low, and there are isolates. So almost 90% contain protein in these supplements, and there are hydrolyzed products. Hydrolyzed means it is digested. Protein is digested, so it will absorb much faster compared to other products. So all these products are available in the market, but you have to identify what's best for the athletes. So another frequently used supplement is bicarbonate and beta-alanine. So mainly for athletes who develop lactic acid in their system, we can use bicarbonate and beta-alanine to neutralize acid levels in the body. And BCAA means branched chain amino acid pre-workouts and mass gainers are quietly commonly used among athletes, but their effects are questionable. There are not that much research to confirm the benefits of these products, but very widely used. And there are micronutrient supplements. So ideally you need to check blood levels of micronutrients in athletes. Ideally you need to do at least once a year. So according to my experience, at least when you check 10 athletes, at least 7-8 people are deficient or insufficient in vitamin D. And magnesium is another micronutrient routinely find deficient in athletes. About 50% of the athletes are deficient in magnesium. And mainly in female athletes, iron HB levels are relatively low most times. So we need to have a higher cutoff than the general cutoff for athletes because their physical activity level is relatively high. So according to the athlete's requirement, we can start these micronutrient supplements, and majority of athletes require some form of micronutrient supplement. So the problem with supplementation is doping. Doping means the use of banned substance in competitive sports. So it is a very problematic thing. WADA is the authority agent of this area. WADA means World Anti-Doping Agency. Sri Lanka also has Sri Lanka Anti-Doping Agency. So every year WADA publish prohibited list. So it contains over 250 categories, product names. So as doctors, we have to be very careful when you're prescribing for an athlete, because most of the commonly used drugs are in this list. For example, beta 2 agonists are here, salbutamol, salmeterol are in this list, and glucocorticoids are here. Prednisolone you can't use in athletes without a specific requirement. And furosemide are here, erythropoietin. Mostly commonly used drugs are in this prohibited list. So when you are prescribing for athletes, you have to be very careful not to prescribe these kind of drugs. And even beta blockers are here. And when it comes to supplement, the contamination risk is very high. The doping risk is very high compared to a drug. So even products that are manufactured in highest manufacturing places, there's a high chance of contamination. Contamination can happen intentionally or unintentionally, but we have to be very careful when you are prescribing supplement for athlete. So if you get positive with a doping substance, if an athlete gets positive with a doping substance, they get a ban at least for 4 years. So very critical thing. So I think you all know about Marion Jones and Lance Armstrong's incidents. So they got banned for life. So when you are prescribing a supplement, that supplement should contain third-party batch certifications for anti-doping free, to tell that is anti-doping free, doping free actually. So there are few companies that give third-party batch testing. These are the ones. So in the local market, these products are very limited. It is very limitedly available. So if you are not, if you can't find these kind of certified products, you should not prescribe a supplement for a national or international level athlete. The fourth part is the body composition. So if you don't have the correct body composition, your agility, speed, and performance will go down. So ideally, you need to have a correct body composition. The body composition change according to the sport to sport. So most times when you have obesity or high amount of fat, people tend to use fasting method to reduce weight. But for athletes, it is not ideal at all, because when you use a fasting method, the muscle mass will also go down significantly compared to non-fasting method. So for athlete, reducing muscle mass means it's a significantly negative thing. It will affect, it will increase the injuries, and muscle power will go down, will have negative effect on performance. But when you use fasting method, you will reduce your weight very quickly. But if you change your diet even slightly, it will you will regain your weight very quickly. And so for the general population, fasting methods can be used for a shorter period, but in the long run, it will have more negative effects. So this is the gold standard method to assess the body composition. It's called DEXA. DEXA we use to assess the bone mineral density, but it can also use to assess the body composition. It's a very relatively cheap investigation. You can do this for about 7,000 to 8,000, range of 7,800, 8,000. So it gives comprehensive detailed body composition. So being an athlete is a very difficult thing actually. So you have to do a lot of things that we don't see. To achieve high goals, you have to follow a lot of steps. When the nutrition is step one, even less than step one. So you have to follow proper sport nutrition plan to achieve higher goals very easy. Getting into the highest level is relatively easy, and maintaining that level is much more harder than that. So you have to follow a proper diet plan for a longer duration to get the maximum performance benefit. So listen to this. This is Virat Kohli talking about.
From next day onwards, I just changed everything about my diet. Hitting the gym 2 hours a day, just taking a day off in a week, eating proper lean food. I got away from all kinds of junk. I did not have a cheat day at all, and within 8 to 10 months, I lost about 6 or 7 kgs, and then from then on, it became such an addiction because I saw the results on the field. I felt quicker, I felt lighter, felt more focused, and then I was like, man, this is the path I want to walk.
So
Today onwards, everything about my diet. Hitting the gym 2 hours a day. Junk. I did not have a cheat day at all, and within 8 to 10 months, I lost about 6 or 7 kgs, and then from then on, it became such an addiction because I saw the results on the field. I felt quicker, I felt lighter, felt more focused, and then I was like, man, this is the path I want to walk.
yeah, of course, when you do the correct thing, you will, when you do the correct sport nutrition plan, you will see results within 2-3 weeks, and when you see them, the results, you have to follow it for a long time, then you will gain a lot of benefits. So those are the things I want to tell you today. And so I have written a book about sport hydration, because hydration is the easiest one to correct, most cheapest one to do. So it is available in both Sinhala and English languages. I can share it with you once I finish this. And if you are interested about sport nutrition, please join PINES. PINES is the professional association, international most highest high-end sport nutrition association for professionals. So it is you can join PINES, and you can gain a lot of knowledge about sport nutrition by joining PINES. Yeah, thank you.
So there are a few questions. One, sir, when we were explaining about post-practice meals, you said that it's better to have a post-practice meal. But if our intention is to reduce weight, for our colleagues who are hitting the gym, if the intention is to reduce weight, do you still advise on taking post-practice?
So this is for guide for athlete.
Yes.
Yeah, this for a gym. People who go to gym is
different.
It will be different. It depends on their goals. Right. So if they are planning to reduce weight, the meal plan would be different. But still, it is better to take a protein-containing meal after practice, because it will help to improve your muscle mass.
Right. Yeah, there's another question, sir. They say maize protein can't be absorbed by the gut. Soy is not good for male kids. What is your opinion about maize proteins?
No, there's no such a thing. So soy is the best protein to have for a vegan person. Because, so vegetarians, the best protein source is soya, because the protein content is relatively high. So 2 tablespoons give 7 grams. Right. So if you are a vegetarian, the best protein source for you is soya.
Right. Then sir, when to take whey protein? It's one question.
Yeah, as I told earlier, that whey protein absorbs much faster. So if you are taking a whey protein, the best time to take after practice, as the post practice.
Is it good after workout, or can take as you wish? Still on the whey protein.
So ideally you have to calculate the protein requirement first, the individual protein requirement, right. And you can have so most times you can cover the protein requirement from diet alone. So so sometimes there are practical limitations. You can't take a meal like that. So yes. At that times you can use a protein supplement. Mm-hmm. The best time to take protein supplement is after practice, because that is the best, the most important time to regain muscle mass and improve muscle quality.
Yeah. So these days we are having our big matches, sir. So this question is regarding that. Is it okay to have cooled drinks during the matches?
Yes, of course. So by drinking cooled solutions, you can increase the volume you drink. Rather than a non-cooled product, you will drink more when you drink cooled one.
Another question, sir. Is it recommended to take whole eggs or egg whites only without yolk, even if you want to lose weight or if you have high LDL levels?
So having 1 egg per day is okay for all the population, but for athletes, I usually you can go up to 3. But there are some athletes who take 10-15 eggs per day. So in that instance, you can use only egg white if you are going more than 3 for a day. Otherwise, you can have
1 egg. Yeah. What are the good soya products for vegetarians?
So actually the products in the market we can't recommend actually because we don't know how they prepare. Most times the quality of products in the markets are not satisfactory. So there are raw soya meats I'm not talking about the TVP. There are soya, whole soya, like lentil. We can buy soya in the market, so that is a better product than TVP. And there are products like tofu. Tofu is a good source of protein also.
What is your idea about taking glucose during matches?
Yeah, so glucose has a positive impact. So if the event lasts more than 1 hour, you have to take a carbohydrate based snack. So you can take fruit, fruit or a date or even glucose. It is okay to have during activity. But if it is lasting more than 1 hour, there is a benefit. But for a shorter duration activity, there's not that much benefit taking carbohydrate snack.
Right. So what are the best protein sources in Sri Lanka food setup?
So ideally, any animal-based protein is relatively better than a plant-based protein because most of the protein amount in the product will absorb. Animal proteins absorb much better, and fish will be a better option for most population but when you are going for fish, the highest priced one and the lowest priced fish doesn't have a significant difference. Say all the fish contain the same amount of protein, so there's no point going for a higher price one. Even the lowest price one contains the same amount of protein in a 30 gram. So in 30 gram it contains about 7 grams.
Right. What is the place in zinc and D3 in muscle building?
So vitamin D, as I told earlier, most of the athletes deficient or insufficient in vitamin D. So it is negatively affect for a lot of things in the body. So even for muscle building. So if you are deficient in vitamin D, you have to correct it to get a better benefit. And zinc, usually you can cover the requirement from diet. You don't need to supplement zinc. But if you are taking a multivitamin, it will be better.
Is there any clinical diagnostic procedures to judge if kids are having microelement deficiencies?
Yeah, you have to do blood investigations. So they are asking about micronutrients, right?
Yes, sir. Is there any clinical picture that we can, rather than going for blood tests?
That's the problem. So vitamin D deficient people doesn't have a lot of symptoms. So it will affect negatively, but there are no physical symptoms to show. Even magnesium deficiency will not show significant clinical symptoms.
Right,
so some magnesium deficient people will have more cramps. So that is a thing we can do, identify magnesium deficiency. So easiest way to correct if you are getting cramps, manage hydration.
Right.
And even after managing hydration by supplementing correct amount of fluid volume and correct amount of sodium, then you can assess magnesium level to identify whether there is deficiency. So most times magnesium level is low in frequently cramp athletes.
Can we empirically prescribe vitamin D, or do we have to investigate before prescribing?
Ideally, you should investigate, but most times athletes and even general population are deficient in vitamin D. Almost 80% are deficient or insufficient. So vitamin D test is relatively costly. It costs around 8,000 most times. So it is okay to prescribe empirically in some situations, lower dose actually, not a higher dose, but you can take empirically because most times all are deficient and the toxic level is relatively high. So you can prescribe a lower dose in most times.
How much protein do you recommend for a teenage player per day?
It depends on their requirements. So their weight is the main deciding factor, and if you are planning to build muscle, the protein requirement will go up.
I think, as you mentioned before, most of the questions are coming pertaining to the kids because our kids are in sports. And the other question is, can we take multivitamins with whey protein shake?
Yeah, it's okay. So if you're taking a multivitamin, you can take best time to take a multivitamin is in the morning, and a protein shake, if you're taking it, best time would be after practice.
I think that's all with the questions for the time being, sir. Thank you so much for that splendid lecture, sir, and I appreciate you taking time off your busy schedule to enlighten us on this special topic, and hope you would come and enlighten us on such matters in the future as well. And so thank you all for staying with us. We'll meet you back again with another academic session. Have a good day. Thank you.